A new study out this week in the journal Cell indicates the shingles vaccine may slow down the progression of dementia, especially among women. Before we look further into that, though, let's understand how they analyze their data. This is a figure from a paper by the same group that was published in Nature in April of this year, and they're using the same data set in the study that was just published this week. So these data are collected from Wales, and what happened in Wales was on a specific date in 2013, they started shingles vaccination for older folks. And anyone who was 80 or older on that date was not eligible. But those who were 79 and almost, 79 and 51 weeks, they were eligible. And so they looked at what happened to those two groups, those who were just slightly too old to have gotten a vaccine and those who were just young enough to have gotten a vaccine on and around that date. This figure here shows you the difference in the rates of receiving the shingles vaccine based on how old people were on September 1st, 2013. So those who were born before September 2nd, 1933 were ineligible. And so you see those very low rates of vaccination on the left of that figure. And then those who were born on September 2nd or later of 1933, you see the jump to a much higher rate of getting vaccinated, which is almost 50%. And as the authors demonstrated in that paper, that difference in the vaccination rates seemed to translate to a lower rate of dementia among those who were eligible for vaccination. That's why you see here that there's a lower rate of dementia diagnoses to the right of the line, representing people who were born September 2nd, 1933 or later, than those who were born just before. What was really fascinating to me as someone who thinks a lot about women's health was that the difference seems to be largely driven by a benefit among the women patients, where there was a larger gap, meaning there was a greater benefit, greater protective effect, it seems, of the vaccine among women than among men. In the paper that came out this week, the authors found having received the vaccine seemed to be associated with a lower risk of developing mild cognitive impairment and death due to dementia. And for both of those outcomes, mild cognitive impairment and death due to dementia, the benefits seem to be greater for women than for men. There's a lot that's unknown here, including how the shingles vaccine might potentially decrease the rate of dementia or the development or progression of dementia. And there's two main theories at this point. One being that it does this simply by decreasing the number of times somebody has a reactivation of the varicella virus, which is the virus that causes chickenpox and shingles. The other being that the vaccine's activation of our immune system in some way provides a benefit. The greater benefit for women may be due to the fact that women's responses to vaccines tend to be more exaggerated than those of men on average, and that women are more likely to have shingles than men. More research is needed, of course, to understand all of this, but isn't science pretty cool?